All right. I want to welcome everybody tonight. This will be our final talk for this season. Then we're going to take a summer vacation and restart again in the beginning of September. We'll be sending emails out. I want to thank everyone for coming. This is Baltimore County Fire Department's EMS Academy. Tonight's topic is going to be emergency care for people with intellectual disabilities or developmental disabilities, which is a very important topic and something that's routinely seen. I'm going to bring back Nikki Austin, who we all met last time again, and she's going to start with the introductions and take it from there.
Hi, everybody. Welcome back for our last session for the year. I'm Nikki Austin. I'm newly retired nursing faculty from Towson University. So I get to do these things in my spare fun time. I do ride at Pikesville, and I find this a really interesting topic. And I have to say, I met Carol Adams in another venue and heard her presentation and said, we have to do that. So we've actually been working on this, Erica and Carol and I, for months, trying to adapt this program to from law enforcement to emergency care. So you'll see slides that were really intended for another venue, really working with law enforcement, but we're really trying to make this work for emergency care as well. So I want to introduce you to Dr. Carol Adams, newly minted Dr. Adams, who's been a nurse since 1995 and worked with all age groups of patients. She currently works with medically complex children at home and school settings, and recently successfully defended her dissertation, which was titled Barriers, Facilitators, and Competencies in Advocating for Adults with Intellectual Disabilities and Healthcare Disparities. She was a student for that at Duquesne University in Pennsylvania. She's also a nursing consultant for individuals who self-direct their services through the Developmental Disabilities Administration. And a special welcome also tonight to Elica Wheeler, who is the chair of the State of Maryland Ethan Saylor Alliance. Oops, sorry, I just messed up my screen. Erica has presented to the Maryland Law Enforcement Commission and has led numerous trainings to various law enforcement agencies and worked to update the process. Previously, as a vice chair of the Maryland Commission for the Community of Inclusion of People with IDI or IDD, she led a listening tour in Maryland to hear from different families and law enforcement officers about interactions that they've had together, which is really important. In 2006, Patty Saylor and Erica received the Community Advocate of the Year Award at ARC's National Convention. She's also contracted with the ARC of Maryland as an Empowering Partners Facilitator, and she's now serving as Secretary of the Board of Directors for the ARC of Carroll County. So I just want to have a good shout out. Welcome to Carol Adams and Erica Wheeler. And I'm now going to turn this over to Erica, who's going to take it away from here.
Good evening, everyone, and thank you for joining us. And thank you again for all your services in keeping us safe and healthy in our community. I really appreciate it, coming from someone who's a patient myself. So you might want to get to know a little bit about me. I have been in Special Olympics for 32 years, and I've had many interactions with the police, but I've also had many interactions with doctors and nurses, such like yourselves. Before I get into talking about people with IDD, I also wanted to let you guys know I am coming up on my 2-year being a breast cancer survivor. So thank you for all your services. So you can see the joy in my face when I say thank you to you. Have you ever known somebody with a disability? What was it like for you when you first met them? Did you feel scared? Nervous? Anxious? How did it go? Maybe you wanted to feel a little different. People with disabilities are just the same like anyone else. This is my friend. This is Ethan Saylor. Ethan Saylor was a young man with Down syndrome, and he's the reason why we do this training. Ethan was celebrating his 26th birthday, and unfortunately, his interaction with the police ended in tragedy. He wanted to go in to watch the movie, but unfortunately, the officers did not know how to interact with him. Unfortunately, they dragged him out of the movie theater because they were too afraid to talk to him. And the last thing Ethan said, I don't want to go to jail. I want my mom. And unfortunately, Ethan has passed away. So after that happened, life needed to change. When I heard about this, I was very concerned. How was I going to feel safe in my community? So we got together and we realized it was because this young man had Down syndrome, they were afraid to interact with him, and they used lack of force and poor judgment. So then, in 2013, Patty got together and she formed an Ethan's Law training group. And it was people with IDD to talk about what should change, what should happen next. Well, when I heard about this, I knew life needed to change. I was contacted by the Governor's Commission's office, and they said to me, Erica, would you like to help us out? I said, sure. So they asked me to apply for this disability commission, and I was able to serve on it. Also, Tim Shriver, who is the president of Special Olympics, which his mother, Eunice Shriver, had founded, was asked to lead the group as well. So he said, Erica, you are a true leader of this group. You need to decide how this training should go for these police officers. What are the different parts we need to do? Because we can't bring Ethan back, but his legend needed to live on. And Patty fought for that. And then I came in and I started fighting on the commission. And then we went on local tours to meet families. And I met other people with disabilities. And they said, Erica, we just want to be understood in our community. We want to feel safe when we're walking down the streets. We want to feel wanted. So that's when we also decided, I said, that people with disabilities need to lead these trainings, because unless you live in my shoes, you don't know what it's like having a disability. We may become involved in different scenarios. What we learn today is what helps us. The person with the disability may not always be injured or lost. They may witness a situation and say, like, a police officer comes up and starts talking to us. The person with the disability is going to feel nervous, especially if the police officer starts talking to us too fast. We're not going to understand. We needed to form different ways on how to communicate, because we could witness an accident, we could witness a robbery, or we could find ourselves in a situation. But I also said it has to go further than police officers. When we were developing this training, it has to go for the paramedics. It has to go for doctors, because when I go to the doctor, I talk to my doctor. My mother doesn't speak for me. So our hope was, when we divided up this when we developed this training, we had to decide that the person with the disability had to be trained and also has to be trained on how they cope with the folks and how to speak in front of a crowd so they don't feel nervous, because we all have ways that we can communicate, kind of like how I'm speaking to you guys now. We teach them how not to feel nervous because they can do anything. All people with disabilities, they just want to feel safe and understood in their communities. That's all we really want. We just want to be normal people. I can't tell you how many times I walk down the street and I see a police officer and I thank them. And they'll have a normal conversation with me, but sometimes they're a little nervous. When my doctor came in to see me yesterday, he had a normal conversation when he was examining me to make me feel comfortable. Gee, Erica, what are you up to this summer? How are you feeling? That's all people with disabilities. We want to feel understood because we're just like anyone else. I love sports. You could talk to me about sports. The Orioles. I'm a big Disney fan, a big Harry Potter fan. Just treat me like a normal person. And that's what we pull in all one of these trainings that we do. We say we just want to be understood in our communities. When we wrote up the training, we had to identify the best ways that people with disabilities can interact with first responders. We had to figure out the best ways to set it up and different scenarios that happened. And then we had to decide these people with IDD who are going to be teaching the training, where do they come from? What qualifications do we want them to have? They asked me, Erica, what do you think? You know? And I said, just get a person who's motivated to have fun with. Because you want the officers and the people in your training to have a good time. That's my most important thing. I want them to have fun, be comfortable, interact with me. I don't want them just to sit in class like this. La-di-da. That's not me. So I had to teach the folks, hey, you can be motivated. You can tease them, have some fun. Just make sure you stay on subject. That's what I tell my students all the time. And we needed to make sure that when we did the training, we kept saying, just understood, just understand us, have a little patience with us. And that is the real reason why this training is so important. And also, if a person has a disability and the police officer or first responder or doctor come up to them and try to interact with them, we want to make sure that they feel understood and they also know the Disabilities Act. Because if they don't know the Disabilities Act, something could happen. And that's exactly what happened to Ethan. So, before I go on to the next section, does anybody have any questions? So, section 2, we wanted law enforcement or people with IDD to work together. Define common characteristics. Find out about the person with the disability. Understand them. Find out if they have Down. You can basically see Down syndrome, a person with Down syndrome, but you may not be able to see my disability either. You have to learn how to work with us. Just because you can't see my disability Doesn't mean I don't have one. Work with us. Help us understand. Because even people with disabilities, we may not want to talk to you just because we might be in shock if we see the police sirens. We might be in shock if we see a paramedic coming up to us. We might be in shock when you come with us with a stethoscope. People with disabilities sometimes get overwhelmed, and you have to learn how to work with it. And everybody's behavior is different. Everybody's social skills are a little different. Somebody like me who's very good at talking, but somebody else, like one of my friends who has Tourette syndrome, you may think he's doing something because he makes noises. But let me tell you, when he's with me, the noises stop. It also depends on the situation and the person with the disability.
Did you want me to take it from here, Erica? Okay. All right. Thank you so much for getting us started. That was great. I was so excited to meet Erica and realize, oh, good, we're going to have a co-presenter, because that was the whole intended purpose of when this training was developed through the Ethan Saylor Alliance with our modifications to fit first responders. So to go on about definitions and characteristics, so intellectual disability is a disorder characterized by limitations both in intellectual functioning, reasoning, learning, and problem solving, and in adaptive behaviors, which covers a range of everyday social and practical skills. So developmental disability is an umbrella term that includes intellectual disability, but also includes other disabilities that are generally apparent during childhood and originated before age 22 and are likely to continue throughout the individual's life. And the most common developmental disabilities are, and most of you have probably heard of all of these because they are more common, ADHD, which is attention deficit hyperactivity disorder, autism spectrum disorder, cerebral palsy, Down syndrome, epilepsy, fetal alcohol spectrum disorder, hearing impairment, intellectual disability, Tourette syndrome, and vision impairment. So developmental disabilities might consist of physical or sensory impairments only, such as blindness from birth, while others may affect movement, communication, or intellectual functioning. Most people with developmental disabilities are only mildly affected and are not easily recognized as having a disability. Their disability is often hidden. Many people with developmental disabilities have co-occurring psychiatric issues such as anxiety, depression, OCD, which is obsessive compulsive disorder, or bipolar disorder. So about 1 in every 6 children have a developmental disability. Developmental disabilities are a diverse group of severe chronic conditions that are due to mental and or physical impairments. So the CDC tracks the following: autism spectrum disorders, developmental delays, emotional disturbances, hearing impairment or hearing loss, intellectual disabilities, speech or language impairment, Tourette syndrome, and specific learning disability. So these high numbers show that our families, schools, and communities are touched by various disabilities. you're likely to have many opportunities to interact with people with disabilities in your everyday work and lives. Sorry about that. Okay. So before discussing how intellectual or developmental disabilities may impact a person's interactions with first responders, it's important to consider our own perceptions of disabilities. Too often, we mistakenly view people with disabilities as outside of the norm to the point of exclusion. And often we make sweeping generalizations about how a certain disability may affect a person, and every person is different. Just an example, I currently have a short-term assignment where I am going to school with a little boy in Loudoun County. So I ride the school bus to school and back home after school. And the bus aide said, you know, Carol, he doesn't look disabled. So, and that's a common misperception that, you know, if someone's disabled, you should be able to see it. So, but you know, we're talking about, you know, the majority are hidden and not something that can be easily identified. So that was a good example of what I've seen just recently in my experience. So in any presentation about a group of people, it's easy to make generalizations, though we may reference people with this or that. We recognize that every person is different. Terms like high functioning or low functioning can be ambiguous because there's not one definition for each of those terms. It's like saying someone is talented in everything or just in one specific area. So high functioning in self-help skills, but low functioning in math. Rather than use such terms, we should view people with disabilities in the same way we view everyone else, with a wide range of abilities, skills, and talents, as well as a wide range of challenges. Many people with disabilities live very independent lives. They work, they go to college or trade schools, they get married, they are parents, and enjoy their communities just like people without disabilities. So developmental disabilities generally impact communication, language processing, sensory processing, social interaction, and behavior. People communicate with the skills they have to convey their thoughts and emotions. Someone with developmental disabilities may have fewer tools to express thoughts, emotions, and needs. When a person cannot verbally communicate or their communication is not easily understood, they communicate with nonverbal language such as body language, facial expressions, or actions. Imagine trying to communicate frustration, pain, or other emotions without using spoken language. That's it would be very difficult. So there are common communication challenges, atypical communication patterns, greater difficulty with expressive language, apraxia, a motor speech disorder resulting in slurred or unintelligible speech, challenges interpreting nonverbal signals. So something to think about as providers, what do you need to discern about the individual with these challenges? And these are things that you can think about as we proceed with the presentation and identify which protocols would need to be addressed in the presence of these challenges. So language processing challenges. So first responders should be aware that interactions with people with developmental disabilities will require more time due to the manner in which the person understands, processes, and communicates. So think about it this way. So put 20 seconds on your phone's timer. Let the timer count down 20 seconds. This is how long it may take someone to understand one question you have asked or direction given. Think about how impatient you may become in 20 seconds. Would you likely repeat your question, ask another, ask several other questions in that 20 seconds if you got no response? And something I was thinking about when I was going over this presentation is someone who they speak English as a second language. So when you speak to them, a lot of times they are translating what you said to them. If your English is a first language, they're processing it, they're translating it in their head to their language, and they're coming up with a response in their language. Then they're translating it back to English so they can give you a response. So it would be kind of like that because they are processing, but it is taking time to respond because they understand it better when it's in their own language. But that's a little bit off topic, but a similarity, I would say. All right. So I'm going to take any questions.
I'm not sure if it was for everyone, but on my end, it paused for a second. I
Yeah.
think you were asking if anyone had any questions.
Mm-hmm. Yes. If there aren't any questions at this point, we can continue and we will have plenty of time to answer any questions that you have. So this slide explains that when interacting with a person with developmental disability, as anxiety increases, the ability to process language decreases. So this is a good visual to remember when you're communicating with someone with an intellectual or a developmental disability. And my screen just froze. I am not able to go to the next slide. All right, I'm gonna stop sharing and then share again.
Take your time.
See what happens.
We can see it.
Yeah, the slides are frozen. I can't move. Let's try it again. Ah, there we go.
Oops.
It's magic. Okay, so additional processing issues would be echolalia, which is a little bit difficult for me to say. It's not a term you hear on a regular basis. And so that's repeating what is said, difficulty formulating a response. For example, if you say to a young man, "Hi, young man, are you okay?" The person may respond, "Hi, young man, are you okay?" So they're just repeating, they're echoing what you said. Word retrieval, difficulty formulating a response to questions, especially open-ended questions. The default may be a rote or yeah, so we already discussed that. So an example, if you ask someone who is obviously upset, "Are you upset?" They may respond, "I feel fine," but it's clear they are not, but in the moment, that is their root response. While some people are very capable of self-reporting, making an assessment of how they are doing, others may be very challenged to do so.
Carol, I'm going to jump in for a second. Tanika's asked a question in the chat box where
Okay.
it's an interesting question. She wants to know if companies make medical alert bracelets that say IDD or developmental disabilities. And I think a medical alert company will put whatever a patient wants on that bracelet, or that identification, whether it's, the round necklace or a bracelet or whatever that is. And they can even be now scanned, so you can have a medical alert that doesn't say anything, but providers just need to scan that. So that's a really good question, reminding us to look for identification if we have somebody who's not really able to answer questions or speak to us for, it might be a traumatic injury, we just don't know. But that's a great question. Thanks, Tanika.
Yeah. Thanks for the question. Appreciate it. So sensory processing issues, people with developmental disabilities may have different responses to the input their body receives through their 5 senses, and this can cause over or under sensitivity. Common responses to sensory processing challenges, they may have greater sensitivity to lights or sounds. They may pace or rock back and forth. They may constantly tap their feet or wring their hands, and they scream. Chewing on inedible objects, difficulty with body awareness and balance, and higher than average tolerance to pain. So social interaction differences. Some people with developmental disabilities may have difficulty following or understanding social norms. Social expectations may not be clearly understood or may be too difficult to follow due to a person's disability. So some social interaction differences. They could be overly social and challenged to recognize boundaries, overly trusting and may misinterpret affection, difficulty forming and maintaining peer relationships, difficulty making or sustaining eye contact, difficulty interpreting social cues or body language, difficulty understanding and respecting personal space. So more social interaction differences. People with developmental disabilities may touch others excessively, atypically for sensory input, laugh or giggle at inappropriate times, self-talk, they talk aloud to themselves, or they may struggle to express emotions. So there's behavior differences. Behavior is the way a person acts. Behavior is not negative, bad behavior. Some people may have obsessive tendencies, passions, or routines that are difficult to interpret or may cause anxiety when interrupted. Impulse control may be significantly challenged. People may act quickly without considering or understanding consequences. Emotions, fears, or anger may be displayed through actions or outward behaviors rather than words. So vulnerabilities, people with developmental disabilities generally are not violent. They are more vulnerable. Of the few cases in which people with developmental disabilities have been involved in a crime, they are often influenced by other participants who do not have a disability. People with developmental disabilities are at greater risk of victimization compared to people without disabilities, verbal, emotional, physical, or sexual abuse or neglect. So just for example, 1 out of every 2 females with a developmental disability is sexually assaulted. It's highly prevalent, unfortunately. I'm sure that you've heard of the American with Disabilities Act, which is a federal civil rights law passed in 1990. Guarantees equal opportunity to individuals with disabilities in state and local government services, public accommodations, employment, transportation, and telecommunications. By law, people with disabilities are entitled to the same level of access to law enforcement services as provided to those without disabilities. So why the greater risk of victimization? Impaired cognitive abilities and judgment, physical disabilities and limitations, eagerness to please others, believe perpetrator is a friend, difficulty deciphering actions that may constitute a crime, insufficient adaptive behaviors, difficulty understanding safety and ways to protect themselves, inability to report victimization or seek help. So I have a few questions for you. Actually, these came along with the presentation, but think about these. So developmental disabilities generally impact a person's communication, language processing, and social interaction. So when encountering a person with a developmental disability, you should use gestures and act out what you're trying to communicate. B, speak calmly and slowly and avoid using metaphors or jargon. C, place your hands on them and direct them to where they need to go. D, avoid interacting with them and look for a support person who's present. So what does everybody think the correct answer for that question is?
B as in boy.
Correct answer. Good job. you definitely don't want to place your hands on someone because they may really feel threatened by that. And it can be very frightening. And especially if they're sensitive to touch, somebody that does not like to be touched. And definitely you should definitely speak with that person first, and if they're not able to, if you're not able to help them, then, it's okay to see if they have a support person, to see if they can help. But first, always try to communicate with the person first. And next question. Most people with developmental disabilities are only mildly affected and are not easily recognized as having a disability. Is that true or false? Any guesses? Oh, maybe it's in the chat. Let me see what people are. Oh.
Yep, we have true, true, true.
The answer is true.
Mm.
All right. And the final question. Whoops. Okay, great. Now I can't get to well, anyway, I can read that question to you. My slides are frozen again. So, which of the following is true about developmental disabilities? A, they are apparent in childhood and originate before age 22. B, they are likely to continue throughout the individual's lifetime. C, they can often be diagnosed alongside co-occurring psychiatric issues. Or D, all of the above. I know you can't see the question, but what do you think the answer is on that? Okay, we got a lot of D's, which is the correct answer.
Mm-hmm.
That's awesome. All right. Well, that is the end of our presentation, and we definitely want to open it up to any questions that you might have. Feel free to ask away.
Yep.
So, I think one, it's an excellent topic. I have a daughter who's disabled secondary to having brain surgery. So she's got a lot of motor issues, and she's learning to walk, talk, and function again. And it's a very slow process. Personally, I've been riding on an ambulance now for 40 years. And I've always found because you will come across these patients, that an open mind, a smile, patience, you'll get cooperation. It just might take a little bit longer, because the majority of the time there's a certain degree of fear involved, because here you are, a stranger that they have never met. But you can still talk to them as if they're your best friend, because they can be your best friend, and things go fine. A lot of times for these patients, the dispatch will also put out in the comments that the patient might be special needs or has some disabilities. And you'll see the request to please turn off the sirens before arrival and the flashing lights, because that has a tendency to cause startle. And the honest truth is those lights and sirens aren't really necessary once you're at location. So there's no reason not to turn them off. And you'll find that things work well. My own observations.
Good comments. Thank you.
Yeah. Yeah, thank you. Because I've had the experience of being taken out on an ambulance, and luckily the paramedics who came to pick me up was somebody who went to school with me, and he immediately knew what to do with me, so I was pretty lucky. I think I probably wouldn't have been as lucky though, but he worked with me. He knew exactly what I needed, and actually they didn't turn on the sirens when they took me to the hospital. They just made sure they were going to move quickly to get me to the hospital to get me the care I needed.
So we want to open up if anybody has questions about maybe scenarios that you've had or calls that you've had where things went really well or things did not go really well. If there anything we could do to help facilitate that, this would be a great time to share. Of course, you know, hiding all relevant facts about the patient, of course, but. So if there aren't any, if nobody has any other questions or comments, then I think we are good for the night. Erica, did you have anything else that you wanted to share?
Just thank you again for all the work you do. And if at any time you guys need to contact me for something to do a training, I'm more than happy to do it. I just am so thrilled that I'm able to do this work and to have Ethan's legacy live on, because it could have been so much different.
I strongly suspect we'll be talking again for the next year. This is a reoccurring series, and there's always updates, there's always changes, and there's always more information and more people. So I think this is a very necessary topic. It's not uncommon at all.
It's not.
All right, well, thank you everybody for joining us. We hope that you have a great summer ahead, and we'll see you back in the fall.
Thank you everyone for coming. If anyone has any suggested topics, please write them in your Google form, or you can send an email to from the document that you received with the announcement. I look forward to seeing and hearing from many of you. I thank everyone for attending. I'm sure Sean is looking at us and he's happy as can be, and this will continue.